Welcome everybody to this MDS roundtable. My name is Guillermo Garcia-Manero from the Department of Leukemia at the University of Texas MD Anderson Cancer Center. And I'm very pleased to be here today in this teleconference. I don't have experience with Imetelstat because we were not part of the studies. I don't know if any of you has had any opportunity to use the drug or were part of the study, Jamie?
So we are actually we have a waiting list of patients. We're trying to get the drug formulary approved here. We also were not part of the studies, although, certainly I think there are some considerations here just having in preparing, to use this agent. It is, a longer IV infusion that does require some pre-medications. We have seen some transient cytopenias in terms of neutropenia and thrombocytopenia along with this agent. So I think in talking about some of these, quality of life measures, that certainly, this also becomes a consideration. Now, very much to Tom's point, we have so many patients that are going to, utilize and benefit from every single one of these agents in sequence. But certainly, I think there are, some dosing and toxicity considerations that are unique to each individual agent. So, more of that story, I think, is going to unfold as we get access to this agent and more experience using it. But I'm just excited to have options. Like I said, we have plenty of patients with lower risk transfusion dependent MDS who have failed, luspatercept have failed, ESAs. And, again, we're just waiting to get this tool into our hands and hope that they're going to be one of those sort of 40% of responders. I think it is exciting for patients who do respond. The responses tend to be quite durable. So I think this, this newer agent is also going to be very life-changing for a lot of our patients with transfusion-dependent lower risk MDS who have failed other agents.
I agree with you that the more drugs we have, the better.